हाँ तुम्हाला देते मी. हो एकच मिनिट. आता करू शकता तुम्ही. हो मी सुरू करते. नमस्कार, गुड इवनिंग टू ऑल. आज के स्त्री रोग लेक्चर सीरीज में आप सभी का बहुत बहुत स्वागत है. हमारे साथ है वैद्यप्रिया देशपांडे मैडम, जो कि टिळक आयुर्वेद कॉलेज पुणे महाराष्ट्र से हमारे साथ जुड़ती है. काफी सालों से स्त्री रोग की प्रैक्टिस करती है मैडम. एमडी स्त्री रोग है और काफी अच्छे से जो उनकी प्रैक्टिस या एकेडमिक्स उनका बहुत अच्छा रहा है. और ये आज का हमारा विषय है कि ओबेसिटी को लेकर आज मैडम हमारे साथ शेयर करेंगी. चाइल्ड ओबेसिटी जो एक बर्निंग इशू है, करंट समस्या है, और एडीएचडी. तो स्वागत है मैडम आपका.
थैंक यू.
यू कैन स्टार्ट.
I need a permission for screen sharing.
Yeah, I have given you. You can easily. You can.
Difficult. I think you have to make me host for the same.
Yeah, yes. I have made already co-host. Yeah. Now try, ma'am, please once again.
नहीं दिख रहा है.
You can easily. You can. Now it's okay. You can share easily.
But how it's not showing anything? Only आप और मैं दो ही दिख रहे हैं इसलिए.
हाँ, yeah.
हाँ.
But it's live on FB.
Okay.
Yeah. हाँ.
Start recording on or casting with Zoom. ये करना है या शेयर करना है?
नहीं, शेयर स्क्रीन. यहाँ पे ग्रीन बटन है ना, वहां पे शेयर स्क्रीन करना है. ग्रीन बटन आप मोबाइल से है?
क्लिक किया.
हाँ.
हाँ. शेयर व्हाइट
तो आता है ना शेयर स्क्रीन करके.
या
हो गया.
हाँ. आपको मेरा फोन दिख रहा है क्या अभी?
नहीं, कुछ भी नहीं. नथिंग इज देयर. नथिंग.
ओके. I don't know why I'm not, because every time the permission मिलती है, so I'm able to share, but I don't know today. मैं आपको भेजूंगा मेरे पीपीटी अभी इमीडिएट व्हाट्सएप पे, या फिर आपको विदाउट शेयरिंग चलेगा?
हाँ चलेगा. विदाउट शेयरिंग बोल दीजिएगा. विदाउट शेयरिंग कोई बात नहीं. आप ऐसे ही.
समथिंग इज सम टेक्निकल इशू.
नहीं, ओके मैडम, आप कंटिन्यू कीजिए. थोड़ा आपको जितना समय है उतना, क्योंकि लेट हो चुका है तो.
हाँ, our lecture was supposed to start at 4:30 and that time my laptop was also. Anyway, so let's start. Let's not waste our time. So we are today discussing about the pediatrics in Ayurveda, sanskaras and its importance, child obesity. But I think our today's main topic is child obesity, ADHD, that is attention deficit hyperactive disorder, and prevention with holistic approach. Okay. So Kashyap Samhita, we all know there are a lot of references. It is Vriddha Jivak Tantra, and there we find many descriptions about teeth and dental disorders. Then separate chapter is written on Lakshana Adhyay, then Vedana Adhyay, then smooth Panchakarma therapies for children are described and everything. So I think I should skip some slides about the sanskaras and all, and diet in Chiran Nada and Annada Avastha. And just to note down the references, if some newcomers or some interested students are there, Charak Sutrasthan 27th Adhyay 224th shloka, and Sushrut Samhita Sutrasthan 45th Adhyay and in 57th shloka. So about the sanskaras, just I'll run past because ADHD is closely related to these all sanskaras. गर्भाधान संस्कार, पुन संवन संस्कार, सीमंतोन्नयन संस्कार, then जातकर्म संस्कार, कर्णवेधन संस्कार, नामकरण संस्कार, then निष्क्रमण संस्कार, अन्नप्राशन संस्कार, then मुंडन चूड़ाकर्म संस्कार and upanayana संस्कार. These are the sanskaras which are explained in our ancient texts. I think first let's go towards the obesity. What is obesity? We all know is Medorog. We are today discussing about the child obesity. The research says this presentation which I am sharing with you is I have presented this in Tel Aviv, Israel, in Tel Aviv University in Broshing campus. And that's why I have given this reference of that 30% of all adults and all, even the children in Israel struggle with obesity, and the figure keeps growing. So we should combat obesity among the young by better monitoring the food served in schools, community centers and the youth clubs, and banning the vending machines in schools. ये सब फॉरेन में बहुत रहता है. Even in India, in our आसपास हम जब देखते हैं तो बहुत सारे accessible food items रहते हैं जो junk food schools में बच्चों को बच्चे जाके बीच में ले आ सकते हैं वैसा. So this is the main cause. Child obesity leads to severe chronic diseases such as diabetes, high blood pressure. I am audible, na? Hello?
Yes, ma'am. Yes, you are audible. You are audible. Yes,
मेरी
yes.
आवाज अगर आ रही नहीं है तो आप मुझे फोन करके बताइए, बिकॉज मुझे स्क्रीन दिख रही है तो मुझे ये नहीं दिख रहा है कुछ बाकी का, इसलिए.
नहीं नहीं, आप विजिबल हो. हाँ, प्लीज.
नो बट ऑडिबल हूँ ना, दैट इज मोर इम्पोर्टेंट.
यस यस यस.
जब मैं मेरे स्क्रीन, मैंने अभी जो थोड़े से पीपीटीज में से शेयर किए तब सुनाई आए क्या?
यस यस यस.
ओके. So child obesity, as I said, leads to severe chronic diseases like diabetes, high blood pressure, cardiac issues, orthopedic disabilities, and more. Beyond the physiological damage, obesity also causes mental anguish for and fat children who suffer from poor self-image. This is more to concern also. Child obesity is precursor of polycystic ovarian disease or polycystic ovarian syndrome in girls, and also infertility, endometriosis, etc. in women. What is history of obesity? The obesity word is derived from the Latin word that is obesitas, which means a stout, fat, or plump. Isas is the past principle of idere, to eat, with ob, and over is added to it. Our Indian textbooks, our great surgeon Sushruta Samhita, Sushrutacharya in 6th century BC related obesity with diabetes and cardiac disorders, and he also recommended physical workout and treatments to help cure it and its side effects. So obesity is a medical condition in which excess body fat is accumulated to the extent that it may have an adverse effect on health, leading to reduced life expectancy and or increased health issues. Staulya is famous since ancient times. Obesity is Staulya. In Charak Samhita Sutrasthan 21/34 is the reference. We find in Ayurveda, which Ayurveda explains the basic causes of Staulya, and the inference of Varaha is given to the obese person. In Charak Samhita Sutrasthan, same 21st Adhyay, Ashtav Nindita, 8 Nindita Purushas is explained, and one of them is obese. Ashtanga Sangraha 18, relation between the tastes and obesity is described in details. In Sushrut Samhita 15/37, Sushrutacharya has mentioned that Ahara Rasa is the main cause of obesity. Obesity is one of the most important diseases which is included in the Nanatmaja Vyadhi of Kapha. And symptoms of obesity are included in diseases of Samamedha Dhatu in Charak Samhita, Sutrasthan 28/18. The causes in children of obesity in children are dietary, behavioral, lack of exercise and all, sedentary lifestyle. We see children, kids sitting with mobile and in front of computer screens. Physiological, psychological, tension-free attitude or psychiatrist illness, then genetic susceptibility, endocrine disorders, and medications. Excess amount of guru, heavy, which is heavy to digest, then madhura, sweet, then shita, cold, and snigdha, oily. Excessive dietary calories, wrong management of lifestyle of kids by the parents, all the fatty food, bakery products, and everything, as we all know. Let's not go into detail. In obesity in children, first let us just in short study the pathogenesis, the samprapti. The pathogenesis, first the exposure to the causes, then production of ama, then derangement of agni, which disturbs tissue fire of fatty tissue, that is meda, agni, then dhatvagni, main, then formation of improper and excess meda, fatty tissue, which accumulates in the body. Then this is all written in arrow down. The steps of pathogenesis samprapti, then obstruction of channels, then disturbance to the movement of vata. Vata in turn increases appetite. Patient eats more and the entire food is converted into improper fatty tissue. Then low fatty tissue fire, which is Manda Dhatvagni, it creates ama. Ama in turn blocks the proper formation of further tissue and other tissues. The next further tissues gets deprived. What are the Purva Rupas, three cardinal signs of obesity? Accumulation of fat on the abdomen, dyspnea on exertion, lethargy, perspiration. We all know the sutra, Medastu sarvabhutanam udareshu avatishtati ata eva udaravruddhi prayo medasvino bhavet. The signs and symptoms. First, loss of enthusiasm, no progress in academics and sports, weakness, bad odor, excessive sweating, excessive hunger, excessive thirst, and depression. The complications in children are explained in the Yoga Ratnakar. All these references are there, which I have explained in my first slide: hypertension, hyperlipidemia, heart disorders, hyperacidity, kidney infection, arthritis, lipomas, fibroadenomas, and in girls, menstrual disorders, infertility, endometriosis, malignancies, cancer, gynecological cancers, and even PCOS, polycystic ovarian syndrome, or PCOD is like the same. So what is the relation of constitution and obesity in children? The kapha constitution children, obesity is common because bala is kapha kal, and also the metabolism is very much slow, and kapha and meda are having the same qualities. In pitta constitution children, because of excessive overeating, sweets, cravings, etc., the obesity is observed more. And in vata constitution children, we find fluctuations. Many times only central obesity is more, or usually these vata persons provide security against their nervousness or anxiety, and they eat more sometimes. That we find fluctuations, as we all know, vata. The treatment and prevention, as we all know, let's skip all these slides about the panchakarma, medications, clinical protocols, diet, lifestyle management, and exercise and all. Let's run ahead because we have less time and we have to discuss about ADHD also. But the diet, as just in short, what we need, the food substances for the children should be, the kids' diet should be planned considering the qualities like dry, light, warm, without oils, without fatty substances, with pungent tastes, mild bitter, mild rough, without sweet. Food should be with maximum concentration of fire and either elements. Fire and either elements. And you will surprise to see there are n number of tremendous recipes we can create, we can modify, taking the ancient textual references, we can modify the recipes. Thousands of recipes we can describe for the kids. There should be a separate workshop to describe all these healthy recipes for the prevention and management of obesity in children. So we have all the material. Let's plan definitely in future once. I have also conducted in earlier 2 days workshop on the recipes for children, the school tiffin and all. And then let's run towards the herbs and diet. The rules of eating, as we all know, Ushnamasnya, Hitashis, at Matrasis, that everything should be strictly followed. No overeating, no adhyasana, no frozen food. Then hot spices are always good, but considering the Agni, of course. Then care must be taken also that Vata should not get aggravated at the same time. Water, warm or hot or treated with or medicated with pungent and bitter herbs. Then group of such herbs which is explained in the references Ashtanga Hridaya Sutra Sthana 10th Adhyaya 16th to 30 16 to 30. The herbs which are explained in our Ashtanga Hridaya are first Ferula narthex, Hingu, Piper nigrum, Maricha, Embleca ripes, Crimijit that is Vidanga, then Piper longum that is Pippali mula also, Piper longum roots, then Plumbago gilnica which we call it as a Chitraka in Ayurveda, then Piper chaba that Chavaka, then Shunthi, Gingiber officinalis, and garlic, drumstick are also explained in Ashtanga Hridaya, then Haritaki, then Nimbuka, lemon, fresh ginger, wet ginger. These all are explained in details. Just the references are scattered. The bitter herbs group is described. The given group of herbs in bitter herbs group for prevention of child obesity is Siktapatol, then Travanti, then Valaka, then Chandanam. The Latin names I have already written the right side, just for the shortage of time. Nimba, Azadiricta indica, then Katuka, and Agaru. This is again the group of herbs, bitter herbs specifically. We all know that we need to utilize our yukti for using all these herbs in our diet. Other useful herbs are Holarina antidysentrica, Vatsakam, then Sagargota is very much very good and it is explained in details. Then Haridra, Daru Haridra, then Musta, Murva, Arushakam, Patha, Apamarga, and Amruta, of course, Dinospora cordifilia, which is our Guruji. Other therapies, let's skip like dry massage with, there are references of using lavana oil, dhanyamla, that is kanji, and medicated oil with cinnamon and camphor, everything we find in our text. Then strong fermentation, sauna, and everything is explained. Let's skip all those Panchakarma slides for right now. Always treating the obesity in children, we have to clear the obstruction in channels, and obstruction is treated. We all know the basic sutra that शमयतान् प्रयोगेन सुखं वा कोष्ठमानये ज्ञात्वा कोष्ठप्रपन्नं च यथासन्नं विनिर्हरे. And also we all know chaya evam jayat dosham. So the obstruction is treated with the help of scrapping herbs groups. The scrapping herbs are very much detailed explained in our text, including Chitraka and Vacha and Haridra and also Madhu, Yava, and then honey, Yava, hot water, etc. And while treating this obstruction with the scrapping herbs, the care which we are going to take for our patients is to avoid Vata aggravation. Vata aggravation. Then herbs for dry massage are explained. There is again a group of herbs: Terminalia, Chebula, Phyllanthus, Embolica, Terminalia, Bellerica, Pteroscarpus maspium, Ficus resimosa, Ficus religosa, then Curcuma longa. There is a total 10 to 16 herbs which we find useful. We have collected it from our texts only. And then exercise and yoga and Surya Namaskara. Let's skip the PPTs and The medicines which I am using for my patients after the age of 4-5, also in small doses like 125 mg BD, depending on, of course, always never forget Dushyam Dasham Balam Kalam Analam Prakrutim Vayaha and Satvam Satvam Tatha Ahara Avasthascha Putavira, considering all the Prakriti and time and everything. But I use in kids the Trifila Gugula, then Vidanga Loha, then in some sort of, we have a proprietary combination also of Ubi melt, then Kanchanar Gugula, Gokshirati Gugula, and Medopachak, of course, in small quantity. So I'm skipping here the diet and detail slides, and which is our main topic today. Again, is another topic is ADHD, like attention deficit hyperactivity disorder. About the hyperactive kids, we all know the kids who can't sit still, who never seem to listen, who don't follow instructions, no matter how clearly you present them, or who blurt out inappropriate comments at inappropriate times. Sometimes these children are labeled as troublemakers or criticized for being lazy or indisciplined. And occasionally, it is normal to forget homework. Daydreaming in the class is also normal. Occasionally, act without thinking is also sometimes we feel say okay with the kids. But the parents should know the perfect symptoms and the difference. The symptoms of ADHD, which is attention deficit hyperactive disorder, to avoid the further negligence and the complications. ADHD is a disorder that appears in early childhood. The signs and symptoms of ADHD typically appear before the age of 7, and it is sometimes very difficult to distinguish between attention deficit hyperactive disorder and normal behavior. If you spot just a few signs and symptoms and appear only in some situations, it may not be ADHD, but if the child shows a number of ADHD signs and symptoms that are present across all the situations, 3-4 times more than 3-4 times in the at home, at school, at play, and then it's a time to pay attention towards this ADHD. And please don't wait for the diagnosis, but start our Ayurvedic medicine, medical treatment, and lifestyle management with Ayurveda as early as possible in kids. Just now I said Jaya Eva Jaya Dosha is our main sutra in Ayurveda, and Swasthya Rakshanam. What is Swasthya? Sushto Avatishtate Nirogatvena iti Swasthya we know. And prevention is better than cure, of course, we know. So the signs and symptoms of ADHD are inattention, hyperactivity, impulsivity, all or any one alone of all these three. We don't find the name, but we find the reference in our text. In Charak Sanhita, Sutrasthan 18th, we know Vikara Nama Kushalona Jubhyat Kadachana. Also, we know it is explained that स एव कुपितो दोषः समुत्थान विशेषतः स्थानान्तरगताश्चैव जनयन्ति आमयान् बहून् त एव अपरिसङ्ख्येया भिद्यमाना भवन्ति हि रुचावर्णसमुत्थान स्थान संस्थान नामभिः व्यवस्थाकरणं तेषां यथा स्थूलेषु असंग्रह. चरक संहिता, we find this reference that diseases are innumerable due to various causes and different types of aggravation of doshas and dushas as well. And as different symptoms also we observed, Charaka was aware that in future also, due to changes in food habits, pollution, etc., there could be many more diseases. Hence, he said that every disease cannot be labeled. If the physician, Ayurvedic expert study the affected dosha, strotasas, tissues, organs, then definitely we can start or he can start the treatment and become successful in treating the disease. So we know trigunas, sattva, raja, tama. Sattva is light, intelligence. Rajasa, rajoguna is turbulence or motion or action. Then tamoguna is inertia or darkness. In ADHD, sattva is decreased and rajoguna is increased. And buddhi, intellect, is occupied by tamoguna, tamasa. Earth is the capacity for stability in the body and mind, and water is the capacity for flow and feeling. Fire is the capacity for discrimination and digestion, and air is the capacity for motion, both physical and the movement of thought. Either is the capacity of expansiveness and creativity. In the case of ADHD, in those children, there is an excess in the qualities of air and ether and a deficiency in the qualities of earth. Among the three doshas, Vata is the energy of action. It controls all the movements and nerve impulses in the body, and naturally, Vata is vitiated or aggravated when more activity is there. Then chronic aggravation of Vata dosha, preferably in Vata constitution children, will definitely create ADHD syndrome in future. The types, we find types also in ADHD kids. Uh, I have the patients that also kapha predominant inattention type usually we find, then vata predominant hyperactivity type, and pitta it's a combined type of above uh, associated with excessive anxiety and sometimes anger or excessive energy. देखते हैं ना बहुत सारे बच्चे को जो पित्ता कॉन्स्टिट्यूशन है और पित्ता टाइप ऑफ एडीएचडी है वो कुछ चीजें फेंकेंगे वगैरह लाइक एंगर विल बी मोर एंड लाइक दैट. So the causes which we find in our texts are vata prakopa in hello. Hello. हेलो चालू रखना है ना या रुकना है? मैडम, am I audible or not? Dr. Shilpa madam? I think we have disconnected. मीटिंग बंद हो गई है क्या? May I know whether I should stop here? Hello organizers, Dr. Shilpa ma'am. I don't know whether I'm audible or not. Anyone can reply in chat box, or someone can say something. Organizers, from the organizers. I think it is disconnected.
Yes, ma'am.